Health is very different than healthcare. Health is very different than medical or medicine. How technology and healthcare have to combine. Everyone says every physician is a patient-centric physician. We are here to serve the patients. If it takes you 1 hour to be on a phone call, to be able to answer a phone line,
So I'm introducing the first speaker, who happens to be a dear, dear friend of mine, and thank you for driving all the way from Sacramento this morning, Ashish Atreja. There we have your bio up. Ashish Atreja is the nation's leading voice in evidence-based digital health and AI-led transformation. He's the CIO and Chief Digital Health Officer at UC Davis Health, where his work is not just about technology, but about transforming healthcare delivery and improving outcomes for all. And prior to coming to UC Davis recently, Dr. Atreja, who's a gastroenterologist, served as Chief Innovation Officer, Medicine at the Mount Sinai Health System, where he patented a way so that patients could be prescribed health apps directly on their phones, and that earned him the nickname, the App Doctor. We have other nicknames for him too, but you can call him the App Doctor. And the way that I'm connected with him is through our alma mater, the All India Institute of Medical Sciences, from where he graduated, long after me. He holds a master's in public health and is a fellow of the American College of Physicians and the American Gastroenterological Association. He's been nominated among the top 40 healthcare transformers, a mentor at AI for All program, and he actually has to run after his talk because he is supervising an AI workshop for young students back up in Davis, right? And he serves on the board of Node.Health Association and many, many startups. He's published more than 100 academic papers and has been continuously funded by the NIH every year since 2014, which is a huge feat in itself. And he's been a keynote speaker globally on digital health transformation. So without further ado, without eating up more of his 20 minutes, I'm going to hand it over to Dr. Ashish Atreja.
thanks for having me here. It's my first time in CWC, and it's just such a lovely community. I actually woke up at 4 a.m. Just thinking how I can really leverage this community and the power, what it's doing with what all is happening in the AI. So I'll talk a little bit about where healthcare AI is, especially from a health system perspective, care delivery. But really more important is how we can take it into our own lives. How can really make it relevant and meaningful each one of us? Because AI looks very distant, very non-empathetic, non-human, something that many people are afraid of. But it is just a tool. If we do it the right way, it can be the biggest driver of growth, biggest driver for internal transformation, as well as transformation at scale that we've ever seen. I consider this as my fourth career life. Started as a physician, in fact, graduated from AIMS. It's great to see many AIMSonians here, people that are following the path. So just a show of hands, how many clinicians are here? So I can, okay. So around 10% clinicians. So I'll touch upon some of the stuff from clinical side and then move to the real power that is here. And then I realized that health is very different than healthcare. Health is very different than medical or medicine. We are in healthy moment, a full mindfulness moment, every single moment of your life. But our touch point with medical care happens 1 or 2 times with the doctor's visit in a year, right? So those 1 or 2 touch points in a year cannot transform us in a wholesome journey. So that was part of, and then I realized that we have to go beyond to reach people. So I became a very big fan of technology. I was not a geek, but I really became the biggest believer how technology and healthcare have to combine to really make it omnipresent, ever present every time, so we can really be better in what we do. So I did 2 years informatics program, and then I realized we have to go beyond just the electronic medical records. You see doctors are putting their notes on, to actually apps and digital stuff and AI, because that's what's going to be with the patients. Because we have to move from medical care to health that you can feel every single time. And at UC Davis, I see my role as transformation at scale. How do we make sure every single patient is able to get the benefit from the AI and digital health? So this is our delivering tomorrow's healthcare today's vision. We really believe the healthcare needs to be patient-centric. When I talk to my physician friends, everyone says every physician is a patient-centric physician. We are here to serve the patients. But if we really look at beyond the physician lens to a system-wide lens, we are not patient-centric. What I mean by that is, if it takes you 1 hour to be on a phone call, to be able to answer a phone line, or when your kid is having a wheezing attack or something, or a mild fever, you don't know you need to see a doctor or not, but you need to talk to someone, can you get on a call with someone at 11 a.m. in the night to answer your questions, right? So as a system, we are failing. And we know US is failing as a system as compared to all the other developed countries. So patient centricity from the lens of system-wide lens, we are completely not there yet. But how can we really go beyond a one-to-one doctor visit in an office visit to virtual? You can be where you are and you can get the guidance you need, right? How can we go beyond just the guidance you need to actually measurement and diagnostics? Maybe the blood pressure can be measured from home directly and get to your doctor's visit or clinical visit, right? How can we really align all the incentives so you don't worry about you're going to get an extra procedure? How can we really combine value-based healthcare so doctors are not incentivized in health system to do more, but actually get more value with less, right? So there's a lot of that to unpack. But how do we move into this? And that's our vision, delivering tomorrow's healthcare today. But the challenge is this: even though this is our vision and many other health systems here have their vision, we cannot deliver that vision with just the humans we have, because there's just not enough physicians and clinicians here in the world to deliver that. We cannot deliver 24/7, 365, because most of the clinicians already are burned out, right? Except for Pankaj, 54% of doctors are burned out, right? And 88% feel, they are stressed and they don't want even their kids to go into medicine, right? And it takes 15 years for a doctor to get through medical school and really get into a practice. And we're not increasing the seats of the medical school. So, and we are all aging, right? So we all need more and more care, but the care is not coming from the physicians. They are retiring, right? So care has to come from somewhere. And that's where we feel is our burning platform. We are also looking at what Amazon is doing with others. We need 24/7, 365 guidance, not just physician, but a guidance. But there's no one to provide that guidance. There's very big gap between the demand that's needed every time and the supply we have. And that's a perfect example where technology comes in. So we believe technology can fundamentally unlock not just the venue, the place, but also the time and access, right? So what do I mean by time? If we create a digital avatar of Pankaj, for example, and package that into CWC Kushi app, right? Suddenly, what if he has to spend 30 minutes with a patient going through some experience? He can use 3 hours to create that journey in an app, and 3 million, 30 million people, 300 million, 3 billion people can get access to it, right? That's the power of democratizing ourselves. Now, traditional apps may not be able to do that, but when you combine the power of digital front door, digital apps with AI, we can create human intelligence. I would say mimic human intelligence like never before. But the other part is it's not just the clinician side. The patient side has to be ready with a medium. We never had a medium like smartphone before, because the only way to deliver care was patient has to make an appointment with a doctor in the same roof, in the same space, in the same time, right? But now each one of you have a smartphone, right? What you may not know the power of a smartphone, because we have not unlocked the power in a digital medicine perspective. A single smartphone processor, which all of you have, is 1,000 times to 10,000 times more powerful than all the NASA supercomputers, which led the man on the moon in 1969, right? If Neil Armstrong can go in moon with all those big supercomputers you saw, you each have 1,000 to 10,000 times power just in your smartphone. But if we unlock it by connecting with all the sensors you have, all the AI-based cameras you have, all those things, we can unleash productivity in care delivery like never have been seen in humankind, right? And this journey has to start somewhere. So I'd like to take you back to 2010 when iPad came. That's where digital medicine started getting established. And we started building apps. And this is one of the apps, mini apps that were published in Australia. Just to give an example, in metabolic care, many people get heart attack, but doctors who treat those heart attacks don't have time to spend the patient every single day after the heart attack. So many patients actually after heart attack, after a stent, start taking multivitamins more than antiplatelet agent because they feel they are cured. In fact, it's not cure. They really need to take those medicine. So this group actually created a mini app which will just send text reminders to the patients, one-way text reminders, and that showed 40% decrease in smoking cessation rate, decrease in blood pressure, decrease in cholesterol, right? So that's the power. We can democratize it if we have the right kind of care delivered to the patient at the right time. So now we are thinking things have become very advanced. So at Sinai, I had the privilege to actually create a formulary which mentioned where we started conceiving doctors have to go beyond than doing surgeries and medicine to actually prescribing apps right from the electronic health record. So we started this journey around 6 years ago, and we have now touched 30 million lives, and 300,000 patients are touched every single day with this platform. And in COVID, I was in New York City right at the peak of pandemic, really a tough time. And both me and my wife, both are doctors. We were actually rooming in different home because we never know one of us will get sick and will survive that or not. But the same thing was happening to our patients, and we were not having the right information. So they were calling us randomly, like to our call center. 50% of our call center employees were sick. So we got medical students. 50% of medical students were sick. We had so many calls to the patients we couldn't answer. So in 8 days, we created a bot which reached out to 1 million patients, answered their questions, and monitored them on a regular basis. So we democratized ourselves and created a digital avatar of ourselves, which reached out to 1 million patients within 8 days. That would have taken 300 nurses around 400 days to do that, right? So it didn't replace us. It actually augmented our capability because we did not have enough resources to provide that care. Now with generative AI, it's completely a game changer because before that AI was mostly analytic, predictive, but now the right brain is activated. It was mimicking left brain before. Now it can create like a novel, right? It can create all those things. So if we train it the right way, the ChatGPT right now is not trained on medical literature, but if we create a large language model which is trained on medical literature, it can mimic many of the things which you want to follow patients to follow in that regard. So, but it has also created a problem of plenty. There's so many applications in healthcare with generative AI. So I lead a consortium of 50 health system health plan called Valid AI. And we looked at around 35 applications which we should be doing today to really deliver tomorrow's healthcare. But no one has time and space to do it. So I'll just go cover two of these briefly in the interest of time, which are relevant. One of the things you're gonna see is what we call as AI scribe. You may have noticed doctors don't talk to you anymore, and they don't even look at you anymore. It is not because we don't want to or we're not trained that way. It's just the bureaucracy of documentation is so much here in the United States that we have to document everything in notes to be able to get reimbursement. So many times when you go to a doctor's visit, they will say you hi, but they may be with a computer, and then you may not get the experience you want to them. And technology so far has a paradox with healthcare. Nearly every sector, technology has had a positive impact, like banking, travel, whichever you see. But technology had a very bad impact on physicians because it made them just a typist and they're not able to actually devote time. So around 2 hours are spent every day by a physician just typing. I watch my wife nearly every day doing pajama time at 10 p.m. She has to catch up on her notes, right? That's why there's a burnout happening. Finally, with technology, we are there when it is finally saving time for physician. So next time, it is very likely if you go to Kaiser, UC Davis, or other health systems, you may be completely free. The doctors will be completely free of typing because the conversation we are doing like that will automatically not only get recorded, it will actually be formatted in the right manner like a doctor note. All the typos will already be taken care of. In fact, the next steps will already be written right there. So it is completely extending us and freeing up 2 hours of our day, just the new AI scribe. And this technology was struggling before generative AI, but generative AI really unleashed the power. and the cost has come down to $150 per physician per month. But how do you take all those things that are happening many times enterprise wide, but really bring it to ourselves, what we are here for today, with lifestyle and with growth and mindfulness? So I'll share some journey about obesity and the statistics, especially how relevant it is for South Asian population, right? So I'm advising a company investing into it called Fusion Care, but so it's I've borrowed some slides from that, but it is not apparent to us. Especially South Asians may not have a typical profile of looking very big, but they have a very bad metabolic profile. Half of the patient population in US by 2030 will be obese. That will BMI more than 30, basic metabolic rate. Oh, sorry. But more than obesity, many more people will have metabolic complications. There are 200 diseases which can be because of obesity. Many more will have it. And nearly everyone will need a wellness, right? So it's not just 50% of US population 2030 needs access to care. It is every one of us need access to care for wellness. And like was mentioned by Jashri, everyone needs a path, but the path for everyone is different, right? For me, it's very different than Pankaj. Pankaj may be very active, and I may not be that active. One of us may have diabetes. We may have different blood pressure profile. We may have different genes in that regard, right? And my perceptions and my beliefs may be separate, different. I may like more weight-bearing exercise. Someone may like more aerobics. Someone may just like to jog with their family, right? So every person's journey is different. Till now, if we make a unified app, we cannot be like a physician, really understanding the context of the patient and modifying it. But now with generative AI, we can create a complete precision-based experience for you, which is just based on who you are, what you believe in, what you can do. So just very briefly, we've created a generative AI bot, which is completely trained on all the medical literature, which an obesity medicine physician is gonna do. And they are now asking questions, but these questions are not survey questions. You can actually enter text and language, and if you enter your weight and your height, it will automatically calculate your BMI. It will then automatically give you a score, and then it will guide you in the path based on your preferences. So you are basically, in a way, through this experience, a chatbot is made with human intelligence, but this intelligence we have done from a clinician who is obesity medicine certified. But what is being built now is an avatar which you see on the left side. Very soon you will actually start to have interviews with someone from a digital practice which will actually have a conversation like me. It may be a very cute Pankaj here in this Pankaj avatar, which will actually do interview with you and guide you right there. That's where things are going. And wherever things are which is very complicated, they will say, let me hand it over to real Pankaj. Because all the complicated things real Pankaj has to handle, but we can actually really democratize this for you. And this will be in your pocket, right? For 24/7, 365. And then we can create things like this nearly in every specialty. And that's where things are going in an amazing way. The middle things which you're seeing is something that will be available for you in your pocket, where you can ask any question you want, 11 a.m., 1 a.m., whatever time you want, and you will get an answer very close to what a physician will answer. Because this body is trained on exactly on what physicians are trained on, with the same level of testing that we need to go through. So we are also thinking how to go beyond just this intelligence to actually bring everything together. Because you may need a way to measure your blood pressure. We may need AI tools like there's a smart plate. Whatever you put in the smart plate will calculate the calories and the proteins for you right there. It will guide you what is healthy for you, what is not healthy for you, right? There's an app. You do not even have to calculate BMI and metabolic profile. You just take a picture of you. It will calculate it right for you. It will show your progress in the journey, like in a park journey, which one mentioned to. Devices, you actually can have a pocket-sized device which you plug into a power outlet. It will capture blood pressure. It will capture your heart rate, your pulse ox, right streaming to your doctor's office right from your home, right? So we need a one-stop shop for you where you are to actually activate your health journey. And wherever you go across that journey where you deviate from the path, then a physician can call you and guide you. And what we also need is a community which CWC has built, because a lot of empowerment comes from support groups, from us doing things together, right? Like we are today. So how do we build a community which is backed by and augmented by intelligence? We started taking steps for that and bring it all together. And one of the things we need to do is really validate it. Is it really working? Because there's still, we cannot replace the 5 years of medical school and residency and everything. There's a lot of validation that happens. So we need to have the same rigor of evidence-based practice built into every single AI model that we're going to be doing. So we published this paper on implementation science to really validate everything with humans, both patients and clinicians, before we really make it market ready. So a lot more work clearly ahead of us. And that's the journey we call in technology world a journey from innovation to transformation. That's our world of fit, from innovation to transformation. Right? And in the interest of time, I want to end on this slide. Really, it's an internal transformation which we are seeing today with the mindfulness, with that, right? It's the same internal transformation which we need to turn on to be agnostic to technology, not to be afraid of technology, but to think of it as a tool. And if we adopt it the right way, we will have a transformation at scale, which we have never seen in humanity, if we do it the right way. I have taken a QR code for you. If you want to actually be part of the co-creation world, whether you're a patient or a clinician, we will validate and co-create solutions with you. And really, that will be our test to say we are making a relevant difference wherever you are, in a way you want to, and whatever your journey is, in a very precision manner. Thank you very much.
We actually have a few vendors here who are demonstrating wearables. There's so many wearables coming out. And you're right, doctors are burning out. They don't have time to look at all your readings that are coming in from your continuous glucose monitor 24 hours a day, or blood pressure, or whatever else the digital waste that the wearables are generating. So how does AI help us with that?
That's a great question. In fact, I get answered that, asked that many times. I think part of it is being intentional, that if we have to use technology, we call it human-centered design thinking. We cannot just bring on technology. We have to see who's going to use it in what way, and is it creating efficiency for that. So by creating efficiency for patients, we also have to create efficiency for physicians. So it's a both sides, then only the things win, right? So AI is going to automatically, so earlier, when we had earlier version of AI, that could say, hey, you put the rules like, if the blood pressure is only more than this, then create an alert. But now it's getting so advanced, it will actually read the note of the physician to know this patient actually is a heart failure patient. His baseline blood pressure is only 90 systolic. If it goes to 110, that's a risk. So now it can create precision-based alerts. So only alert when it is needed. And it will pass on the alert to the clinical team, the right person in your team. So you may not even be aware in that regard, and patients get managed unless until you have to see them.
Beautiful, thank you. One more question. This is more from a consumer standpoint. As a consumer, there's so many watches and there's so many apps, right? Hundreds and thousands of them. As a consumer, how do I validate which one I should pay for and use?
That's a great question. So there are more than 2 million health apps in iTunes. There are around 4 million in Android store. In fact, one of the reasons we were facing the challenge from physician side as well. When I was recommending like Talkspace and Calm to my patients, when I came back, I only realized 6% of them downloaded it. Because if you type a general name like Talkspace, there's so many apps, they get confused. And then many people don't even remember their iTunes password, right? So, but even if they use it, as a physician, I'm not connected, so I have zero idea. So that's why I think we created a platform where when we prescribe that app, there's a whole evidence-based screening. So we took the aspect of how we have formulary in the medicine, in the health system. There's a whole committee which looks like which medicines are FDA approved, but which medicine comes in hospital. So we set up a digital formulary where clinicians decided, hey, these are the most evidence-based one. And then we gave tool to the clinicians to prescribe them so it lines right onto your smartphone with a URL link. So when you click on that link, it automatically logs you into the app, and I get a chance to know you've logged in. We found in our study from 6% engagement, we found 92% engagement, right? And that's the power of connection. So app alone versus app connected with a clinician or app connected with other peer group, the humans really made the difference in that 6%, 92%.
Beautiful. I think we have time for just maybe one audience question. If there is one, I have more. There's a couple of hands up here.
Size time, what works in one patient does not necessarily work in another patient. So how do you decipher the information? What is applicable to me may or may not be applicable to Nareen Bakshiji. How do you take that into consideration?
Yeah, great, wonderful question. I think part of it is medicine, unlike physics or math, is imprecise. That's absolutely true. We're continuously learning. The key thing is we are trained to, the assessment part is very important. So that's why if you see the physicians need to spend a lot of time, 40 minutes or something, just to know who you are. And that's why if you have a regular doctor, they will get to know you over a period of time. Okay. And their recommendation is always adjusted based on who you are. But what happens in this healthcare today, you may not have a regular doctor, or you may not get an appointment with a regular doctor every time. So you always see a new doctor. So there is a certain ambivalence there. But the way AI is also being trained now is trained on pattern recognition. So I think part of it is accepting in where we are good and accepting where we are not good. And sometimes you still need to make a decision when you don't know what is best for you because you are new. But as far as you have a close remote monitoring tool, we are able to get a feedback from you. I prescribe you a medicine, I don't know if you will tolerate it or not, but I gave it because the first time. But then I have a feedback loop through a text message or something to know it's working for you. Then even if I make an error, slight error, I can correct that very easily, right? So part of it is a regular communication loop where we may start with some variation, but we will come back closer to the truth, what works for you. So the same model we built in assessment bot with AI. So if you saw the bot, which is assessing you for your wellness journey, where you are, so it can give very specific precision-based recommendations.
So, Dr. Veer, we can take one more question.
Okay, one more. Yeah,
There's a hand that was raised here first. I'm going to take it. Sorry.
Good morning, Dr. Atreja. Thank you for the enlightening talk, the last 20 minutes. I have two questions. One is, you keep referring to we and the platform. Is this the fusion care that you're referring to? And is that available only in the UC Davis Center or for, I go to Sutter Health, so would I have access to it? That's one. And second, you're talking about a lot of interactive advice or guidance. In this country, the doctors are very fearful of giving any advice because of the lawsuit situation. How do you overcome that? Thank you.
Thank you for
Great
those questions. So we combine generative AI, which is basically the content generated from the very beginning, with elements of rule-based AI when we give advice. What I mean by that is, like there's a whole nursing book which says, if this person comes with this question, then do this. There's a lot of that if then else, and you can see a mathematical correlation that can be very precise there. So a lot of the things when you have to give very specific recommendation, that is, we use the rule-based logic in that regard. But when we have to give you general recommendation about walking and those kind of things, you can use generative AI in that regard. So you have to combine it, and then you have to test it in the right manner. The platforms are many. I just mentioned platforms in general. I see the CWC app as a great platform and a community as well. There's an effort from Fusion Care. It's an early stealth startup in that space. But the key thing is we need something that creates a one-stop shop for every one of you and a one-stop shop for a clinician. So whether those are in AWS, wherever it comes to, it's a stealth company right now, so you can only get access through this QR code. But the goal is to actually co-create the journey with patients and clinicians to ultimately come out in production, and you can download that.